If standing is a problem, all of these wrist and hand maneuvers can be done seated, and they can be done seated while you're at work too. It's the same principle. Grab the thumb, pull, turn, and twist. And if you want to add to it, you can actually cross your right foot over your left and twist like this. And it adds more tension and more drive. And you do the same thing for the other side, crossing the foot over. And that, following the same instructions, you can do them all seated. So for lower back pain and knee pain, you can try the knee torque. This is really simple. You can use a towel or something to get more grip, and you can also, if you do it on bare skin, it's a little easier. What you want to do is take your hands and you want to put your thumbs forward and down on the knees and right over the cap. And what we're going to do is we're going to turn the skin, and we're literally turning the skin on the knee. That's going to turn the fascia and create rotation around all the joints. So you take your hands in here, grab a good grip, and moving your elbows outward. And as you do this, I lean forward and I put my chest up. And what this does is it starts to reduce the tension between the knees and the hips, and it starts to crawl all the way up the back. Now we want to start breathing. Breathe with me. 2, 3, 4, 5, 6. And you see I'm constantly turning more, which can be a little hard, and if you can also have somebody assist you with this. But keep turning and put out your chest as you need to, stretch your neck, and breathe through your nose. 2, 3, 4, 5, 6. And stand up, and you have brand new hips and brand new knees. Okay, we're going to do a quick ankle release. Ankles are very important because it's not only the ankles, the foot and the calf. What we're going to want to do is you take your leg, cross it over, and you take both hands. What you do is take your one hand, you grab around your ankle, and you take your second hand and you grab there. You counter rotate, twisting like this, okay? And as you twist, then you start to move the foot around and you breathe. So I'm literally pushing down with my foot and my ankle, and I'm twisting and pulling up this way. So I'm stretching on a boot, and I'm moving and I'm breathing. And you can counter twist as well. So you counter rotate and then just move slowly and get all angles of the foot, just like that. Let's do the other side. Really, really simple. Put your leg over, hands counter rotated, twist, and start to move the foot and breathe. It's really important that we breathe here, because without breath, fascia doesn't move. And let's counter rotate it the other way. Feels so good. I mean, this really feels good. There you go, and you have brand new ankles. Okay, now let's do a quick wrist release. This isn't going to get everything, but this is going to get you moving. Okay, what you're going to do is you're going to take your one hand and take your other hand. You're going to twist the skin, literally twist it. So grab it, twist it, and so you're creating tension. And as you create tension, what I want you to do is flex the hand and then move the body and breathe. And stretch as far as you can. The more you move it and the more angles that you get, the better it is. And move the hands and move them around and move the fingers. It's awesome. Works magic. And let's do the other side. Again, grabbing here, twisting, turning, and pulling. And I literally feel like I'm pushing my hand through a glove. And I flex back and I start to turn and move slowly. And breathe sharply. Fascia like sharp breath. Intentful breaths. And move and twist and move your arm. Pull it, push it through. Stretch. Any angle that you can do. Wow. New wrists. Let's turn something that you may know into something that's even better. Let's take a stretch and turn it into a complete hip release. So what we're going to do is we're going to sit down and lay on our backs. And we're going to take our right leg and put it over top of our left. And we want the knee to go right over the hip. And we're going to bring our legs up. And you're going to grab each leg like this. And what you're going to do is pull the skin apart. So the object is to pull the skin and pull it back. So I'm pulling down and back. And then I'm going to pull my head up to the right side. That's counter rotation, fetal position. And I'm going to breathe. Breathe in. 2. Feel free to move a bit. To the nose. And I usually hold this for somewhere around 12 to 15 breaths or until my hip drops. And I'll usually feel the hip drop on the right side. And we're going to do the same thing on the other side too. Roll back, take your left foot, put it over top of your right, pulling up. Again, pulling away, pulling the body as much into fetal position as you can. Turn your head to the left and breathe in. Very forceful. Through the nose. Again. Through the nose. There, my hip drop. And you'll see that I'm alternating between mouth and nose breath because mouth breathing drives force into the hips pressure and nose breathing drives force pressure up into the diaphragm, shoulders, and neck and head. Try this and you will be amazed.